Oh, yeah. We continue our work. The topic public consultations, how to reform public health. Our guests are Ulana Suprun, acting Minister of Healthcare of Ukraine, Oksana Syvak, Deputy Minister of Healthcare of Ukraine, and Anastasia Vorobyevska. Anastasia, the floor is yours. Good afternoon, ladies and gentlemen. Thank you for your time, for finding time to come to this consultation. Why are we organizing these consultations with all the stakeholders? In democratic world, there is such a thing as a full cycle of public policy, which allows to work with vision, problems, and decisions, solutions. What we see in Ukraine is writing many concepts, programs, which are not implemented because they are mostly of political nature. On the other hand, we see the legislation which is being drafted, produced in abnormal amount, but then it's not executed because there's no connection between these two elements. What is the complete cycle of policy? As Dr. Ulana Suprun did, the policy agenda for reform of medical system was developed. It formulates what is the vision of the reform. We discussed what are the problems and obstacles to achieve the vision. After that, the consultations with stakeholders are held. Today it's the fourth one in Kiev, but Dr. Suprun and her team travel to regions actively, and it is important to have this personal contact. During the consultations with the stakeholders, it is important to understand how are the problems perceived, whether these are the problems which hamper achievements. After we have some consultations with the stakeholders, we draft the green paper which has the analysis of all the positions of the stakeholders, and that is what's done now. After the green paper is drafted, we discuss whether this is like check of the problems, whether these problems are important, whether solving these problems will lead to the vision. After that, we draft the white paper, where part of that is the proposals on what should be the solutions, and the draft law which will be implementing the policy. Because in Ukraine, policies differ too much from laws. White paper unites it, combines it, and the draft is the one which will allow to implement the vision that we want. And then there are stages of hearings in the sectoral committee at the Verkhovna Rada of Ukraine and parliamentary hearings in the Verkhovna Rada of Ukraine. After that, the law should be approved. Dr. Suprun and her team, this is the only ministry which follows this democratic way of developing the policy. And we appreciate that, because myself, as the citizen of Ukraine, I do have hope that it will be better to get treatment, and maybe we will be not getting sick so much. Dr. Suprun, Oksana, please take the floor. Good afternoon. This is also Dr. Oksana. She's also the doctor. Thank you all for coming. This is our fourth cycle of discussions. I'm happy that our friends, our colleagues came, those who are interested in public health. We had several discussions already. We were talking about the change of, we discussed the referent prices, and now we are discussing the public health. Many people, many Ukrainians believe that the concept of public health is something new. This is nothing new. This is taking care of your health, of the health of the whole country. That means preventive medicine, vaccinations. These are all the things that we want to do as the state, as people, as nation, so that we do not get sick instead of spending so much time and resources for treating the diseases. We want to be healthier, to live longer, and to work longer. Why? Because these are the correct steps of the civilized European country. In Ukraine, only 1% of our funding and our attention goes to prevention. 99% goes for treatment. When we go to regions, when we talk to people, there are many questions on whether there are some programs of treating oncology patients or TB patients, but there are many questions as to what are the programs of communication on vaccinations, what are the programs which will be preventing the cardiovascular diseases, instead of just talking about treatment. And public health is working on that. In the Ministry of Public Health, of Healthcare, we are happy that we have a team which can give information, can communicate how important all our programs are. These are young people, doctors, professionals who can communicate to people, and it is more important, they know how to listen to them. It is more important than talk yourself. Today we are here to, for the first time, present briefly the program of the public health, the concept that was passed at the Cabinet of Ministers last week. Oksana will tell you first, and it is important for us to hear from you your questions, your advice, so that together we go to the future when Ukraine will be taking care of public health, where we all will be healthier, happier, and we will live longer. Now I would like to give the floor to Oksana Syvak, the Deputy Minister of Healthcare of Ukraine, and she is working on the issues of public health.
Thank you very much for coming. I'm happy that today we have discussion of the public health, which includes prevention and prophylactics. In Ukraine, we got accustomed to a situation when we start thinking about doctors, medicines, diagnostics. When something happens, we should change our approach and put more emphasis on prevention. Of course, we will take care about patients, about ill people, but people with diseases, but people should pay more attention to prevention. The World Health Organization offers the following definition of the public health. The public health includes science and practice of strengthening health and extending life expectation, and people live better, live longer, feel better, and save more money on treatment. This is the target for us for building a public health care system in Ukraine. As you might know, the mortality rate in Ukraine is at the level of 86% from non-infection diseases. When we speak about prevention, we keep in mind infection diseases, and at the level and we can easily show that the level of infectional diseases depends on vaccination. The level of public health here depends on the level of vaccination, and that's it. But 86% of mortality from non-infection diseases is very bad. There's cardiovascular diseases, traumatology, psychiatry, and etc. So the set of problems which we wish to resolve, the critical rate, the critical characteristic for us is coverage with vaccination. The level of vaccination in polio, for example, before last year, when we had 2 cases of polio in Ukraine, was at the level of 18%. Now the vaccination level is 95%, but nevertheless, there is some doubts among population about the necessity of it. They said our biggest concerns is HIV, tuberculosis, and C hepatitis. Also, biosecurity. Biosecurity is an important issue. Our labs are not prepared to testing of dangerous infections. For example, they are not ready to diagnostics of Ebola virus, Zika virus, and some others. So we have to act proactively. When we speak HIV, tuberculosis, hepatitis C, here we keep in mind the security of blood stock. What is done as of today? A week ago, the Cabinet of Ministers resolution had passed the concept of the public health care in Ukraine. The concept is like memorandum of intentions, and now we have to do much in this area. We have chosen the direction, a vector for movement, but now we have to implement our plan step by step. We had already developed the action plan. We have a Center of Public Health. Now we establish work relations with the regions. The laboratory centers, which in the past belonged to the state sanitary service, now they are under our umbrella, and we now are testing their capacities. For 2 years now, we do not have the sanitary and epidemiological service. Whether it is good or bad that it is in existence, we do not know, but nevertheless, the function of biosecurity is put on the ministry, and our function is to prevent infection diseases. Currently, we try to revive the operational level of this service, and in each region we plan to have the centers of public health. Quite often I hear a question whether this will be just the revival of old sanitary service. No, we think that There will be the Center of Public Health with attached lab and with attached statistical data center, which will carry out prevention functions, try to prevent the diseases, and which will have electronic databases reflecting the real situation and showing the real picture with the public health. And we hope very much that those data will be reliable, not just that we wish to see, but just to know the situation. We would like to invite the International Renaissance Situation to
Foundation.
say International Renaissance Foundation to add about the healthcare index. In a moment, you would hear about the healthcare index, which reflects attitude of people towards their health and the perception of healthcare.
Коротко, те, що
What's interesting for that discussion, Renaissance Foundation in 2015 supported the development of the strategy for reform of the system of healthcare. Developing the strategy, we were thinking that we need to introduce the independent objective instrument which will allow us to measure the reform, to help the leaders of the oblast, which receive now more powers and more money for this reform. I believe that the health index is like some medical indicators, but no, in this sense we're using the index of the health of the system, and this index has 10 indices, maximum is 100 points, and we take 10 main which are responsible for the main directions in the system of healthcare. I would like to emphasize a family. 12,000 respondents participated in the survey. We assessed 10,000 questionnaires. The main directions which were assessed is the satisfaction with the medical assistance. We were talking about the services of the family doctor. We were evaluating the experience of the family as to going to doctor in case if there is a disease where the people would refuse from going to the doctor because they didn't have money. Where did they go? Because that's one of the elements of public health. Are we using the initial stage?
третім елементом індекса це є два показники по
Another element are expenditures on medical assistance and medicines. And it's how much the family spends in case of a disease. The least they spend in Zhytomyr region, 250 hryvnias per month. And in Rivne region, it's more than 1,000 hryvnias for the last 30 days. For some families, these are disastrous expenditures. Also, another element, knowledge about health and behavior. What I, as the member of the community, am doing to preserve my health. So we were assessing the index of the mass of the body, knowledge about the stroke, because we know that cardiovascular diseases prevail in the country, are the main reasons of death in Ukraine. I will not present you the information for every region. This is the brochure which has 10 indices.
що не увійшло в індекс, але
And what was not included into the index is the vision of the population. Most people said that it's not the Minister of Public Health. We understand that it's not the minister who treats us, but our family doctor. And we will be informing that your information should go from your family doctor, but not from the minister. And we are planning to support it for 3 years, maximum for 5 years. And 3 most expected changes: change of quality, reduction of expenditures for medicines and for diagnostics and treatment. This is a good example of decentralization. The health of the patient depends on a patient and on family doctor. And the Minister of Health. But as to public health, that is the responsibility of the Ministry of Healthcare, because the ministry is dealing with the health of the whole country. And the figures that we receive, it will be interesting to see how they change in the future. I hope they will be improved. And how the vision of people changes on who's responsible for the improvement of the system, who they can go to. Very often people come from far away from Ivano-Frankivsk to come to the minister requesting about a solution of some problem which is to be resolved locally. Public health is something where a lot happens in Kyiv, but a lot happens in the regions. 2 important announcements. We have only 20 minutes for your comments and questions, and please ask questions only on the topic of public health. Please introduce yourself. Good afternoon. I'm Natalia Kozhin. I would like to inform you, with the support of the World Health Organization in Ukraine, our analytical center Socio Consulting organized the survey on the reasons and obstacles why in Ukraine the vaccinations are not made. We will present this data in the Center of Public Health in January. There will be a round table organized, but I would like to draw attention to 2 things which we saw in the result of that survey. First, the reasons why. First, that is the lack of vaccines. We ask the medical workers, people who make decisions, the parents. Second is anti-propaganda made by mass media. And it was offered to us to develop the strategy of Ukraine for awareness campaign on vaccinations. We believe that we shouldn't be limited only to developing the information strategy on vaccinations, on immunization. We have one suggestion, and we could discuss it at the Center of Public Health. There should be the Committee on Information Committee, which would develop the standards of the curricula and will assess in all media the information which goes to the population. We have developed a strategy and we invite you all in January to attend our roundtable. We do support that communication is the priority. It's sad to hear there were no vaccines. That's some justification. Now you know that the situation has changed. But it's sad to hear that medical workers say that people shouldn't be vaccinated. And I believe that is that we need to talk more with the patient. But we see that even now, when we organize trainings for medical workers, for media, still there are some medical workers, doctors who say that people should be vaccinated. Thank you. Good afternoon, I am Anna Kovalchuk. I am a practicing doctor. Today I represent the NGO GAPAC. My question is to you, Oksana. According to the concept, what practical things are you planning to apply to find those patients with cardiovascular diseases, TB, AIDS, HIV? Parallel to the concept, we have the reform going on, the prevention and early discovery. That's an indicator of the work of the doctor at the primary stage. If we now ask who knows your doctor, I'm sure that 70% will say they don't know. That is at least what my friends are doing. Our strategy is that is when the doctors and the patients will know each other, and it will be more about prevention because the doctor will be motivated financially. You know that we have the concept of the change of financing, which is approved, and the doctor will be interested in patients to be healthy. We're working on the screening tests to discover the diseases that you mentioned. Talking about reference prices and reimbursement, we will encourage patients who have problems with cardiovascular diseases or diabetes of the second type, so that they go to their family doctors, so that they receive recipes and then they can get their medicines free of charge. They can get reimbursement. That's encouragement of people to follow the correct way of treatment. We would like to treat the hypertension with pills instead of a person to have the stroke. This is the prevention of diseases and early discovery of diseases which we can treat easier. The next question. Deputy Chairperson of the Ukrainian Association of Public Health. I will give some definitions. In the context of the development of the system of public health, the public health is not the medicine. We need to tell some simple things that our health depends on medicine, only 10% of our health depends on medicine, the rest on the environment and other things.
Охорона чого в політиках?
Національна система громадського здоров'я, мабуть, буде носити назву навіть Національна агенція, мабуть, щось таке. Але на цьому перехідному етапі ми повинні все-таки перейти з меншими втратами, кадровими, матеріально-технічними і нормативно-правовими, тому що треба уніфікувати законодавство Європейського Союзу. І, в принципі, я декілька також скажу слів про те, що я своє професійне життя віддав профілактичній медицині, це майже 30 років, так? І думаю, що все-таки, що сьогодні збудовується центр громадського, так, він все-таки йде не в тому напрямку, який повинно було бути. Тобто я не бачу взаємних таких складових, спільних, так, щоб ми об'єднали. Мене більше всього, як фахівця, турбує те, що ми можемо втратити кадровий потенціал. Епідеміолога, який поїде за кордон носити грошки, я вибачаю, скажу так, вже назад він потім сюди не вернеться. А підготувати його за рік, за 3, за 5 буде важко, каже так. Дякувати, що зараз вже ввели спеціальність громадське здоров'я, і на цьому перехідному періоді, коли вже буде майбутня агенція, то вже будуть фахівці громадського здоров'я, вже будуть по спеціальності готові. А сьогодні можна було б зупинитись, ми сказали, сьогодні вже прозвучало, що була санепідслужба, пані Оксана, вона не ліквідована, до речі. Немає ні одного нормативно-правового акта, який ліквідовує санепідслужбу. Були ліквідовані санепідстанції. Сьогодні є фахівці Центру Державної служби соціальних захворювань були, каже, так, центри здоров'я представники. От їх треба об'єднати, на чиїй площадці, на чиїй базі, каже, так. Це вже інше питання, яке можна дискутувати. Я бачу, що це найпотужніша база сьогодні, так, матеріально-технічна, лабораторна, це на базі санепідслужби. Бо якщо будуть тільки центри здоров'я керувати, скажімо так, то тут може бути якась корупційна складова. Дякую.
Ну, про корупційну складову я б не казала, ми кажемо...
Once you're talking about public health, there are 10 items, 5 main ones, functions, 5 main ones. Our task is to cover these functions. We will not dictate to each region what they should do. Our task is to have it happen. Some have very well-developed laboratory center. Some have good center of health. Our task is to execute these functions. Depending on that, the regions will set up their regional centers. The association agreement in chapter 22 talks about public health and transplantation. Europe is concerned with the condition of health of our people. Unfortunately, as of today, we are the reservoir of infections, and they pay attention to that. And we need to take care of our health. That is why we work so actively. And now there is the national and the regional center of public health. As to specialists, yes, we are using the potential that we have. You're talking about epidemiologists and doctors and new specialty. We cannot wait for another 5-6 years till we get new specialists. The specialists that we have now are very valuable. We organize many trainings to improve their knowledge. So two parallel processes will be taking place. The next one.
Good evening. I'm Rada Kishka, a healthcare studio. What events do you plan, or if you plan them? As far as I know, family doctors, as you mentioned, will be interested to have as many patients as possible. Whether you plan any trainings for family doctors, how to work with their patients, and the second, how do you plan to do this? Whether this will be done via chief doctor, or you will take only those who volunteer for such training, or this will be done via the healthcare centers. Actually, we plan do everything that you mentioned. Medical sphere is an area which changes every day. Several years ago, I saw such an article which suggested that for any doctor to be familiar with the latest innovations in the medical area, they have to read up to 17 different articles every day. An example, currently working with the vaccination, we cooperate with UNICEF. They organize training for trainers, and now these trained trainers travel around Ukraine and provide trainings for family doctors and pediatrists. It is very important to train journalists how to deliver information properly, and it is very important to work with patients. I can see our partners, parents for vaccination. I think your opinion is very important for parents. Unfortunately, today the level of trust to vaccination is very poor. That's why we plan to work with both medical personnel and civil society organizations. The next comment, Svetlana Kozak, State Enterprise, the Institute of Healthcare, National Medical Academy of Ukraine, National Academy of Medical Sciences. Would you please explain what the Healthcare Ministry plans to cooperate with our Institute of Public Health, which has considerable findings about lifestyle, diet related to, in relation to the prevention of diseases, whether you plan to cooperate with us. We not just plan to cooperate with you, but we have good partnership relations. You are partners in our roundtables and events. The next question. Nakonieczny Yuri from Caritas Ukraina, working in the east and in the west of Ukraine in many international programs aiming to strengthen public health. I would like to draw your attention to the fact that in the east of Ukraine, as of today, we do not have any information visible about the reform which you discussed today. And the next problem would like to mention about the lack of experts, medical experts, doctors, specialists in buffer zones along the contact lines. Maybe you have partnership relations with international organizations which might provide assistance in this area. Today's morning we met with UNICEF and discussed this issue. We discussed not just buffer zone, but also the non-controlled area. In the non-controlled area, we have those people with rather serious diseases. As of today, only International Red Cross organization may have access in that gray area, and also UNICEF some days ago delivered the cargo of medicines against TB and AIDS to that area. Also, I would like to mention that we have developed and signed orders about enrollment of doctors to these special teams providing services in the buffer zones. There are some specialists like oculists, surgeons, etc., who are ready to attend these areas and provide healthcare services there, but they need to get a guarantee that after coming back they will be given the same position as they have now. At the moment when we entered the ministry in August, we have found the Ministry of Disasters Medicines, and we found that there were only 5 people working in that unit. Now we have strengthened this department. These are former military doctors who travel around Ukraine, attend all the primary aid centers along the contact line and collect all the updated information about needed assistance. As for the occupied territories, this is a big problem. We encourage Ukrainians to come to Ukrainian controlled territory to get aid, medical aid, and encourage pre-front medical facilities in delivery of such healthcare services. And in the ATO area, we have a lot of medical personnel which is dealing with the delivery of services to those people who come from the occupied areas. But unfortunately, still, we have no access to the occupied territories. We have no working relations with the Russian occupational troops in this area. So we cannot deliver any medical help to those people who stay in the occupied territories. Unfortunately, many of those people have no choice, and but these are Ukrainian people, and we continue to encourage them to stay in Ukraine. Of course, International Red Cross is available to deliver services along the contact line, but there are other humanitarian convoys about which you know, and Thank you for attending today's event. We are always happy to communicate to you, to speak to you. You are experts in all these areas. You are experts in public health. And for us, it is important to know your opinion, to hear piece of advice from you, and cooperate with the Institute of Public Health. Maybe you have some findings which we do not know. Our doors are always open. We have a person who deals with public health and who quite often stays in the ministry up to late night and has often meetings with our colleagues and friends. I'm also is open for cooperation with you and discussion of important issues. We are not just doctors, epidemiologists, or experts in other areas. We also are human beings who need medical assistance, and our children and our parents also require medical health care. Healthcare is not just a ministry or a hospital or a clinic. This is a responsibility of each of us personally. If we wish to improve the system, we should do this. We should make a decent healthcare system in Ukraine. Thank you for your attention. Thank you, dear colleagues. Our press briefing is over. Thank you.
Шановні колеги, наша наступна подія в цій прес-залі буквально за 5 хвилин. Прохання продовжувати дискусії уже поза межами прес-центру.